Today, I'm joined by Dr. Swee Kheng, a Malaysian physician in Hong Kong, specializing in health policies and systems with fellowships from the Chatham House, United Nations University, and Institute for Strategic and International Studies. My first question, Swee Kheng, is regarding the key issues and impacts of migrant communities and refugees in response to COVID-19. Can you please expand more on that?
My first thought about migrants and refugee communities as it relates to COVID is that there's an absence of data, that we don't really do a lot of research in this community. Therefore, it's very difficult for us to have a good conversation simply because we lack data. Secondly, one of the reasons why we lack data is because previous to COVID, they are invisible, and during COVID, they're also invisible. I can draw one statistic from Malaysia, which is my home country, that the number of people who have been brought in dead due to COVID, meaning they had COVID, they didn't know they had COVID, and then they passed away due to COVID before they were even brought to the hospital, is actually around 10% of all the total number of dead people who died from COVID in Malaysia. And of the 10% of people who died from COVID in Malaysia that were brought in dead, approximately 40% of them are non-citizens.
Can you please share what role do civil society and local communities have in developing pandemic preparedness and response plans?
Civil societies, non-governmental organizations, non-governmental individuals play a great role in filling in the gaps in the social welfare net of any country. They can also do very systemic changes, for example, to provide long-term educational and employment opportunities to the marginalized populations in a particular country. Civil societies are probably woefully undercapitalized. They don't have enough money, they don't have enough political capital, and they probably have very little social capital that continues to be exhausted due to COVID. Probably more important than allowing civil societies and NGOs to help the marginalized community, citizens or non-citizens, is to create an infrastructure that enables them to help.
I wanted to hear your thoughts that if you were involved in any of these in negotiations, for instance, is there anything in particular that you would advocate for?
This treaty should complement existing infrastructure and help to accelerate the existing infrastructure rather than try to compete with the existing infrastructure. But 190 odd countries around the world really need to make sure that there is enough sustainable funding and capacity building support that is given out to low and middle income countries. Healthy populations, health system strengthening, and public health preparedness are all important components that must be done at the national level, meaning no matter how good an international treaty is, we're only as strong as the weakest link. You can have a beautifully written rhetorical document with beautiful statements that indicate aspirational goals and ambitions. But without enforcement at the country level, we will not be able to make any progress.
For me personally, I think the treaty should also integrate and focus on the One Health approach, which essentially really connects the dots between humans, animals, and our planets. And I know that you've spoken about this briefly before. So can you please share 3 features of this approach that will help us actually preventing future pandemics as well? And I think, we need to make sure that health is part of policy making processes and not just now, which obviously it's been elevated in the agenda, but consistently. And thinking in this, I think this term really helps a lot.
One Health is a relatively new concept. And when I say new, it's probably been around for the last 8 to 15 years or thereabouts. The proponents are actually a coalition, a very fascinating coalition of the willing, able, and relevant coming together to bring interdisciplinary approaches to global health, pandemic preparedness, and also health system strengthening. And as we extend into understanding veterinary science, microbiology, and the environment, the natural environment in which we live in, it will strengthen the way we conduct pandemic preparedness and also plan for not only how to manage COVID today, but also to plan for pandemic X. My second observation about One Health is how tightly integrated all these things are in terms of pandemic preparedness. And everything is so interlinked that we cannot look at everything in a silo. I'm not a climatologist, neither am I a climate change expert. But the bodies of knowledge that we have from geography, for example, as it relates to the environment, needs to be complemented and augmented really with our understanding about how climate change is leading to things like the tropicalization of disease, changing epidemiological patterns of disease due to warming temperatures and climate change. And thirdly, does it increase the risk of pandemics, and how do these risks of pandemic interact with also human mobility around the world?
To wrap up, and one final question, can you please tell me one thing that Europe can learn from ASEAN countries in their efforts to enhance health systems resilience?
But a lot of these, after SARS in 2003, China formed their China CDC, which then centralized all the command and control infrastructure. And China's a huge country. They needed a very powerful central command system. And they built all that, not only the physical buildings, but the entire system and networks and infrastructure for a centralized command and control infra after SARS in 2003. A second example could be from South Korea, that vertically integrated their research to regulatory approval to mass production. And they were one of the first countries in the world to manufacture lots of COVID test kits for antigen and PCR testing. Vietnam is another example. After the SARS heart attack in 2003, Vietnam started investing into their public health infrastructure. And here's a crazy number, 9% is the year-on-year increase of Vietnam's investment in their health system and public health infrastructure. And finally, Thailand. Thailand's got a great example because around the mid-2000s, Thailand instituted almost universal health coverage by introducing insurance to undocumented migrants.
So definitely a lot of valuable lessons we can learn in Europe. And yeah, I really appreciate your time today.